Welcome back to Good Morning Vail. It is Health and Wellness Week, and joining me now we have Dr. Corenman. He's with the Vail Spine Institute at the Steadman Clinic. And Dr. Corenman, there's some staggering statistics out there, especially in the Americans, about how many people will suffer from back injury and back pain. It's
amazing. The statistics really note that 80% of any individual in the U.S. will have incapacitating back pain in their life.
And I've been part of that. I mean, I know what that's like, and it's so painful and it's so debilitating. Everything that you take for granted in your daily life, you can't quite do. But if you do a few steps, some of your guidelines, you can prevent some of these.
Absolutely, and everybody talks about core strength,
yeah.
But I think a lot of people don't understand what the core really is. So I think today is a good idea to talk about what the core is and why it's important for back health.
Okay, yeah, we've got some slides to kind of give people a diagram and idea of what we're talking about. And core strength, yeah, it's not just your belly, it is all the muscles that are surrounding your middle.
Exactly. If we could have that first image, that would be great.
Okay, we'll bring that up.
So this image is showing the muscles of the back, looking from the back.
Okay.
There's fancy muscles called multifidi, rotators, but these are tiny muscles that go segment to segment and really only control individual segments. If we could have the next picture.
Okay, next slide. Bring that up.
This is the abdominal wall. We have flat sheet muscles. There are 4 major muscles that make up the abdominal wall and the front part of the belly. This is what holds our abdominal contents in. And the next picture, please.
Okay.
These are the back muscles, the main back muscles, called the erector spinae. And these muscles actually create extension, and when they're rigid, also make up part of the core.
Okay.
The next one, please. A normal core, most of us unfortunately, looks somewhat like this, where we have our abdominal wall, which is not that strong. And if you look at the mechanism, the diaphragm descends, and all of the stress is placed on the lumbar spine in the back there. The next picture, please. The core really acts like a snake around a water balloon. The muscles, when they contract, actually push the abdominal contents just like a tube up and down. And if we could have the next picture. What happens here is that when the muscles contract, the spine actually is distracted. And so the stress on the spine is reduced substantially. So when people have back injuries and we talk about activating the core to lift, this is what you're really doing. You're contracting the abdominal contents, pushing against the diaphragm and the pelvis, and this reduces the stress of the spine substantially.
Oh yeah, and you know what? You can do this through exercise. You don't need to go through an expensive procedure to strengthen the core. It's just hard work and dedication.
Absolutely true. It helps to have somebody who's really well trained to teach you, a physical therapist trained in Pilates or something of that nature, where you really work on core strengthening. And it takes about 3 months if you have an injury to be able to regain your strength.
And you know what? It's not the no pain, no gain kind of thing that you might think, oh, I'm going to do 100 sit-ups. It's a lot of micro movements.
That's
for all those little muscles.
That's so true. In fact, sit-ups, when you have a back injury, are the worst thing you can do.
Yeah, especially the old-fashioned kind of sit-ups.
Oh my goodness, yes. I can't tell you how many people come in with injuries from that.
Okay. All right. Well, Dr. Corenman, it's so great to have you here and to realize that core strength is part of the ski season, getting ready, and it's just part of life. So if you want some more information, what's the best number to contact you at?
Oh, it'd be 970-476-1100.
Okay.
Or my website at